COVID trends continue to move in the right direction in North Carolina. Daily case counts, hospitalizations, and the percent positivity rate all steadily decreasing day after day. Remaining restrictions are being lifted, raising the question, are we in the endemic phase? WCNC Charlotte's Chloe Leshner is at Novant Health in Elizabeth to explain how we will know when we reach that point.
An endemic is when the virus is more manageable and isn't disrupting our lives like it has been for the last 2 years. Doctors say a key indicator of that will be what's happening inside of the hospitals. But of course, so many people have already accepted that COVID will just be a part of our lives. March 11th, 2020, the World Health Organization declared a pandemic. Nearly 2 years later, many are wondering what it's going to take to cross the finish line.
There's a lot of protection out in the community that's due to vaccines and boosters and, in some individuals from prior infection. So that all, works in our favor to kind of provide community level protection. Dr.
Katie Passaretti, Vice President and Enterprise Chief Epidemiologist for Atrium Health, says right now hospitalizations have reached a valley. Monitoring any future surges will be key. She says communities are most at risk when hospitals are overwhelmed.
The hospitalization metric is the one to continue to keep an eye on. And, when that becomes part of normal respiratory viral season, regardless of cases in the community, that kind of thing, that's a sign to me that it's become endemic enough. We have enough control.
The World Health Organization can redesignate COVID as an endemic if globally case rates are steadily at what they consider normal. But society generally decides it's over before that.
Masks are few and far between. I would kind of add that has been true regardless of, whatever mandates are in place.
Another part of living with COVID will be booster shots. Dr. Passaretti says how many we'll need and when has been a bit of a moving target, but she does think another booster will be needed, just not in the immediate future. In Charlotte, Chloe Leshner, WCNC Charlotte.